our Hunger, Nutrition, and Health and Pregnancy Action Network Quarterly Connection Series. As people are joining, if you would take a moment and put your name and your organization in the chat, it would be great to know who's with us today. You could be doing a lot of things with your time right now. So why be here and why become a part of this growing network? We all recognize the importance of good nutrition and health in preventing chronic disease and supporting well-being from preconception through early childhood. As an action network, we are creating the conditions for organizations to connect with one another and move into action to get results. We're working to change systems, and we believe that now more than ever, we need partnerships in order to do that. You will hear more about how this network has helped others move their mission forward, and we hope you'll want to do the same. So here's a few quick notes and housekeeping items before we dive in. We will be meeting quarterly on the first Wednesday of the month at 3 p.m. Eastern. So our next meeting will be on December 3rd at 3 p.m. and it will have a focus on the emerging evidence of the importance of nutrition during pregnancy. We will follow this meeting with a link so that folks can join future meetings. We are a network and membership is very loosely defined. If you're interested in our mission and our approach, you are invited to continue to participate. You can join these meetings, you can join our LinkedIn, or we'll give you ways to learn about how you can connect in deeper ways with the network. So here's what we're going to do today. Here's what our agenda is going to look like. You're going to hear about the Hunger, Nutrition, and Health Action Network and what we've been up to over the last 1.5 years. You're going to hear an update on federal policy changes to SNAP and WIC. We know there's a lot that's been taking place. We'll hear from several members of our steering committee about how this network has helped them do their work better. We'll learn about the activities of our healthcare provider nutrition education work group, and we'll end with more ways to get involved. So it is my pleasure to introduce Diane Kolak from the CDC Foundation. Diane, take it away.
Thanks, Rachel. It's a pleasure to be here with all of you today. Thank you. I am going to take us through just the brief history of this group. I know that we have a lot of new faces and names on this call. By way of introduction, my name is Diane Kolak. I'm with the CDC Foundation and the Hunger, Nutrition, and Health Action Collaborative. Since we have so many new faces and names on the meeting, I want to help you understand how we got started, what we've been up to, what we're passionate about, and how you might get involved. Lexi, can you bring up the slide deck? Thank you. Next slide, please. So the vision of the Hunger, Nutrition, and Health and Pregnancy Action Network is that all babies are born into healthy, well-nourished communities. And we're working to achieve that vision with a mission to improve nutrition and health outcomes from preconception through early childhood by uniting organizations to leverage their strengths and resources, thereby creating collaborative action opportunities. So that's a lot of buzzwords, and we spent a lot of time putting that together, but we really see the heart of our work as helping to bring partners together so they can maximize the work that they're already doing, so that we can drive long-lasting, impactful change. Next slide, please. Here is our steering committee. This picture was taken at our strategic planning meeting in March 2025. My colleague Anna is going to drop the names of the folks who are on our steering committee for 2025 in the chat. We're very grateful to them and the time that they have put in and everything that they've brought to the table to help advance this work. Next slide, please. Okay, so you may be wondering how did we get here? What have we done so far? Um, I would be remiss to not mention the OHSU Moore Institute for Nutrition and Wellness, which was created in 2012 to translate the science of developmental origins of health and disease, which is an acronym called DOHAD, into improved population health. And OHSU has been a founding leader in this research. They really started convening folks over the last bunch of years, but we came together and really gelled as a group in spring 2024 with our Nutrition and Pregnancy Conference. Out of that, a group of attendees got together to figure out how we can keep doing the work we're doing and help each other do it better. And out of that came this idea to have an action network around hunger, nutrition, and health, specifically in pregnancy. The HNHP launched in association with the CDC Foundation's Hunger, Nutrition, and Health Action Collaborative. You can learn more about that on our website, which is impacthunger.org. And we will share the slide deck and notes from the meeting afterwards. So don't worry about screenshotting things. One of the first components to come out of the Action Network was developing a provider education working group, and you'll hear from that working group a little later in today's agenda. We also have brought together the Hunger, Nutrition, and Health in Pregnancy Steering Committee every month to continue working and pushing the work forward. This is our first quarterly Connect meeting, and thereafter this meeting, we will have more quarterly meetings. And you may have seen in the chat, December 3rd is the next quarterly meeting. So, next slide, please. So what we value, this is a list of our values. You can also find it on our website of what is really important to us: centering lived experiences, facilitating cross-boundary communication, really finding ways and spaces for different groups to connect who may not otherwise have the ability to connect with each other. We also really want to harness the power of partnerships and amplification. Again, our goal is to find people who are already doing this work and help them do it better. And demonstrating impact through collaboration. We are showcasing measurable outcomes by working together, keeping track of who is involved and what connections have been made. And you'll hear about that more also later in today's agenda. And then finally, really central to our work is advancing evidence-informed policies. The science is the basis of all of this. So driving change through policies that are grounded in research and evidence. Next slide, please. So as I mentioned, our next quarterly Connect meeting is going to be December 3rd at 3 o'clock. If you're here in this room with us now, we will send you an invitation. So you can check that box and plan on joining us. We also have a LinkedIn group that's open to anyone who would like to join. We will share the link in the chat to join the LinkedIn group. My colleague Anna put the impacthunger.org website in the chat. There we have a virtual directory where we have organizations who are working on hunger, nutrition, and health. So if that's you, or if you are from an organization working on hunger, nutrition, and health, we would love to have you listed in our directory so that other folks can connect and find you more easily. So next steps, if you'd like to get involved, would be to schedule a chat with our steering committee member to learn more. We have a really great steering committee. We're ready to bring more folks into the fold. And then finally, we have a new learning library that we've put together. And Lexi, can you go to the next slide? Oh, one more. Thank you. So this is our learning library. We will drop a link in the chat in a couple of seconds. We are collecting resources that pertain to hunger, nutrition, and health programs in the US, and we would really love for you to share your resources with us and also utilize this tool. So the instructions are there. If you have any questions, we've got an email address for questions, but we're hoping that this learning library can be something that that helps everyone in the broader community support better nutrition and health through pregnancy. And that is it for me. Lexi, can you take the slides down? Great. And now I'm going to turn it over to Stephanie Hodges, who is a policy expert in all things federal and state policy related in terms of food programs, SNAP, WIC, Medicaid, and we all know that there have been so many changes in the last couple of months. Stephanie's here to walk us through those changes, let us know what might be coming, and answer some questions. So as you're listening, if you have questions, please put them in the chat. And I will turn it over to Stephanie.
Thanks so much, Diane. Can you hear me okay?
Yes.
Great. I'll wait for my slides to come up. Great. So thanks so much for having me today. As Diane mentioned, I'm going to be talking a little bit about policy and really focusing on the impact of the recently passed and signed into law called One Big Beautiful Bill and its impact on federal health and nutrition programs. Next slide. So this bill was passed and signed into law on July 4th of this year. It was passed through what's called the reconciliation process, and that allows passage in the Senate by a simple majority of 51 votes versus the usual 60 vote threshold. As part of this process, the Senate parliamentarian also has to go through each part of the bill and determine whether it meets the requirements for reconciliation and removes any language that does not. According to the Congressional Budget Office, this bill will increase deficits by about $3.4 trillion over the next 10 years, mainly from a reduction in federal tax revenue due to tax cut extensions and new tax cuts, also due to increases in federal spending mostly on military and immigration enforcement, and reductions in other federal spending, primarily on health and nutrition programs like Medicaid and SNAP, as well as changes to federal student loan programs. Next slide. So today I'm mostly going to talk about SNAP. The overall bill cuts about $187 billion from SNAP through the year 2034. One of the changes to SNAP is shifting costs to states for administrative costs. So this is what maybe your Department of Social Services in your state, something similar, is receiving to administer that program. So this is covering their staff and also going down to applications and things like that. So currently, state and federal governments share those administrative costs 50-50. But what this bill does is actually shifts the cost to 75% for states and 25% for the federal government beginning in fiscal year 2027. So that's going to start October 1 of next year. However, where it gets a little sticky and tricky is that in 10 states, county governments actually administer SNAP, and that covers about a third of all SNAP participants around the country. So this is going to require a real strategic alignment across state and local budgets, across operations, and also intergovernmental coordination. Next slide. So the second major change to SNAP is that states may be responsible for funding benefits based on what is called a payment error rate for the first time. You can see here if the error rate is below 6%, states will not have to provide funding for benefits. If it's between 6 to 8%, they will have to cover 5% of benefits. If the payment error rate is 8 to 10%, they'll have to pay 10% of benefits. And if it's greater than 10%, they will have to pay 15% of benefits. One carve out that happened during the reconciliation process was that if payment error rates are greater than 20%, which was 10 states in their fiscal year 2024, they can actually delay cost sharing for a year to really try to work on getting that payment error rate down. And these changes are going to start in fiscal year 2028. And so that's basically 2 years and a month from now. So October 1, 2027. Next slide. So I wanted to provide some examples. We're talking about 5%, we're talking about 75% of administrative costs. Well, what does that mean, right? Are we talking kind of small pennies? Are we talking really large amounts? And so I just highlighted here, these are the 10 states that are doing that county funding part. So you can see here in fiscal year 2024, what the total administrative costs were for those states. You can see what that 50% federal match was. You can see what the county share was. And then you can kind of go along to see what is going to potentially be the increased cost to counties. And these are counties under the new match. So you can see here, there's everywhere from, 19 million to 266 million. So it is pretty significant. Next slide. And then, so that's the administrative cost share. And so this is actually focusing on the payment error rate. So this is where states will have to provide a portion of the benefits if their payment error rate is over 6%. So you can see here what each state, and this is just kind of the first part of the alphabet of states, but you can see here exactly what they would have to pick up in terms of benefit costs if they have those payment error rates of above 6, above 10, and so forth. So you can see here it's pretty significant. And for payment error rates right now, states actually do have to provide a corrective action plan if they do have high payment error rates. So it is something that states have kind of always actively worked on, but have never necessarily been penalized based on their payment error rate until now. Next slide. So there were other changes made to SNAP in addition to the kind of that shifting of costs. One of those was expanded work requirements and narrower exemptions. So for example, it increases the age from 54 to 65 to be exempt from work requirements. It also no longer exempts veterans, individuals experiencing homelessness, and former foster youth from work requirements, meaning they are now subject to a 3-month time limit unless they meet their work requirements. It also impacts parents, grandparents, caregivers of children under 14 because it changes the age of that child for them to be exempt. It changes eligibility based on citizenship status as well and restricts any further updates to the Thrifty Food Plan, which determines SNAP benefit levels. So any update to the Thrifty Food Plan would now have to be cost neutral and occur only once every 5 years. It makes changes to the standard utility allowance, which has been a way for households to claim utility expenses without submitting bills as part of SNAP's shelter cost calculations, which is also considered when calculating SNAP benefits. And I have more information about this in the notes. It's kind of a lot, but happy to, provide additional resources on that as well. And lastly, as many of you likely know, the bill also totally eliminated federal funding for SNAP Ed currently. And it's estimated, kind of with all of these different changes, that about 4 million people, including children, seniors, veterans, and individuals with disabilities, will either see their SNAP benefits reduced or completely terminated. Next slide. So I wanted to pull some examples of language or media reports from states regarding these changes and how they may or may not be able to adjust to them. So the first little snippet is a letter from governors to Congress about the changes with SNAP, stating that they'll have to find millions or billions of extra dollars in their budgets or potentially be forced to completely eliminate the SNAP program if they're not able to come up with those funds. Another really interesting headline announced in early June, Texas announced that they were providing $60 million in their state budget to be able to participate in what's called the Summer EBT program, which was a demonstration program, but is now a permanent program. And then just a couple weeks later, they retracted that, stating that due to the uncertainty of federal funding and the federal funding landscape, they were not going to be able to include that in the state budget. So this is just a couple of examples. States are really going to have to figure out how to come up with lots of additional funding on a really short time frame. Next slide. So there were also a lot of changes to Medicaid, which you probably heard about in the news. And unfortunately, I don't have time to cover all of them, but know that it is estimated that 10 to 15 million people are likely to lose coverage, and that's mainly through states that expanded Medicaid coverage. So this is due to federal funding being significantly reduced or completely eliminated for this expansion population. States are also going to receive less funding based on payment error rates. That comes up again, similar to kind of how SNAP is being impacted. There are also new requirements for Section 1115 demonstration waivers. You might be thinking, oh, that sounds familiar in the nutrition space. Many food as medicine programs, like produce prescriptions or medically tailored meals, are actually operated under these demonstration waivers. There are also expanded work requirements for able bodied adults ages 19 to 64. There are changes in healthcare provider taxes. These are levies imposed by states on healthcare providers that are then used to draw down federal Medicaid matching funds. They often return these funds to providers through enhanced payments, kind of creating a cycle that can boost Medicaid financing. There are also changes to retroactive coverage. So states can or may be required to just completely eliminate this retroactive coverage, which usually allowed individuals to receive benefits for up to 90 days prior to their application if they were eligible for Medicaid, but just weren't on the program. And lastly, you've probably heard about a lot of impacts to rural hospitals through the loss of Medicaid coverage, also due to the reduction in Medicaid spending, the restrictions on provider taxes, and more. Next slide. So while there were not direct changes to programs like WIC or school meals, there still will be impacts. So for example, individuals may be eligible for these programs through adjunctive eligibility. And if they lose SNAP or Medicaid, they may have to either apply directly to these programs or they may no longer be eligible at all. For school meals, so children are directly certified through participation in programs like SNAP, Medicaid, etc. And that allows schools to participate in what's called the community eligibility provision. So all children at those schools receive breakfast and lunch at no cost if enough children are identified as participating in programs like SNAP, Medicaid, etc. That could change if children are no longer participating in SNAP or Medicaid. That's going to reduce the amount of children who are directly certified, which feeds into what is called the identified student percentage. That if that drops to too low, that impacts the school's ability to participate in CEP. So they would then have to revert back to free or reduced price meal applications, which we know are complex and don't always get completed as they should be. So kind of coming back around again, states are going to have to make really tough decisions. Many have already passed budgets for the next year or so. Some states pass budgets for 2-year cycles. And so they're really having to go back to the drawing board. Some states have called their legislative sessions back in to figure out how they're going to adjust to the decrease in federal funding. And lastly, food retailers will also be impacted. SNAP spending accounts for a higher share of spending in low income and low access area communities. And many of these smaller retailers rely on SNAP transactions to stay in business. And then I didn't include it on here because this kind of came up just fairly recently, but some states have actually already reduced benefits in programs like Double Up Bucks. So these are things like farmers market vouchers, because some states provide funds in addition to federal funds. And so they've started to kind of claw back that match because they're anticipating that they're going to have to find dollars elsewhere. And so they're starting to do that as well. Next slide. So I know that sounded pretty doom and gloom, and I apologize for that. That's just kind of where we are right now in the federal landscape. But I'll just take questions and try to answer them as best as I can.
Thank you, Stephanie. Stephanie, this is Rachel. I'm not sure if you can see me yet, but thank you for that really informative presentation. I think you have helped to better simplify a very complex process. No questions in the chat yet, but I did want to ask you, you mentioned a lot of the changes happening into the future, 2028 even. What kind of recommendations might you have about what people should be doing now? Anything you could recommend to those on our call today?
Yeah, they do phase in over a couple of years. One thing that's already gone into effect now, though, are the SNAP stricter work requirements. So some people that started September 1. And so a lot of people are, seeing, oh, there's new requirements to participate in the program. So able-bodied adults kind of within that time frame, if they don't have exemptions, will have to go ahead and meet those work requirements, or they'll just kind of have that 3-month limit on SNAP. But I think for now, the biggest thing is really just to advocate for how important these programs are. Predominantly we do that at the federal level, right? Because they're federally supported and funded, and we think of these as kind of USDA programs. But I think a lot of that has gotten lost at the state level. And so if you have an opportunity to talk to your state lawmakers, just reiterating, because they're the ones that are going to be making these decisions of where do we come up for this funding for administrative costs or for benefits. And so just really being able to tell those stories from people who have benefited from the programs, I think is really important. Still keeping up the drumbeat at the federal level. There's been some legislation introduced to revert back the SNAP changes. And then there's also been some other things happening through FY26 appropriations. We had some hope that SNAP Ed potentially might end up back there. So I just can't reiterate enough like how important that advocacy is. Sometimes I feel like it feels like we're preaching to the choir or we're kind of screaming into the abyss. Like we all know how important this is, but the people making the decisions about these programs really need to hear that as well.
Great, thank you. We have another question that has come in about, we've heard about the changes to SNAP Ed. Can you talk a little bit about what impact that may have on states and communities?
Yeah, so from my understanding and from conversations that I've had, the positions that were doing SNAP Ed have been eliminated. A lot of these through cooperative extensions, through land grant universities. And so those positions have been completely eliminated. There was a little glimmer of hope that SNAP Ed might come back just as part of the FY26 appropriations process. But I'm just not sure where that's going to really shake out. So I do think that's a huge gap. They were in our communities, working with our families, working with our children, to really encourage them to make more nutritious choices, but also connecting them with nutrition resources. So that's absolutely a gap. And so when we're doing a lot of the advocacy work, if we can talk about SNAP Ed and how important it is, is there a potential that states could, do something similar, maybe not exactly SNAP Ed, but kind of really fill that void that we're definitely going to be missing.
Great, thank you. Someone else has reiterated you did a terrific presentation on very complex programs, so thank you. And followed with a question of, is there any data on the impact on chronic absenteeism with these new changes to SNAP or other nutrition programs?
Yeah, and when you say, I was going to say, is that in schools or are you talking about at the workplace? I just want to make sure I'm clear on the question.
Well, I would say we'll see if they put anything in there, but perhaps if you could address either, both or either at work or in schools.
Yeah, so I'm a little bit more familiar with the school landscape. We do have data on, oh, perfect, schools primarily, yes. So we do have data on the impact of school meals on students attending school. I'm actually not sure if that exists for children on SNAP. So if anybody has that resource, definitely let us know. I don't know how these new changes are going to be evaluated. I think it is something that we'll see over time. I'm sure that there are organizations that do research on federal benefit programs that will be looking at any potential changes, whether that's in school or just kind of overall in our economic space. So, haven't seen them yet because some of the changes are just now going into effect. A lot even haven't done that yet. But I imagine that there are organizations, especially schools like BRAC and others, that will be working to exactly determine the impact that a lot of these changes have had on things like you mentioned on absenteeism. There's data on test scores and school meals and things like that. So imagine that we potentially will see that kind of coming down once these changes have been in effect for a while.
Makes a lot of sense. I'd be remiss to not plug again our learning library, and that if you do have some resources, any of you on SNAP, WIC, data, please feel free to fill that in, and we'll we'll make sure to continue to update that library. As someone asked also if there is a table or a quick reference guide for when each of these policy changes goes into effect. You might have something, Stephanie, but I also wanted to mention I have started to follow a site called USA Facts, and they break down a lot of really interesting information. And they did have a section that they did on when all of these changes, and they did a timeline that I thought was really helpful. But any others that you recommend?
I looked through a lot of different websites. CBPP was one. FRAC had some information. There was some from law offices that was actually really helpful because they were able to translate the kind of legislative language into what does this mean. But I'll look and see, Rachel, in addition to the one that you shared, if there was kind of one good one, because I did have to use several different resources to kind of pull that together. So it would be great if there was one in one place.
Great. Well, we'll make sure, and again, to our audience, if any of you have seen these, feel free to drop it in the chat or add it to the learning library. Anna has linked to it again. Stephanie, thank you so much. We have hit our time. Again, that was super informative, and really you simplified a really complex process. So thank you. And these slides will be available to everyone who's here, and even those who aren't here, there'll be a recording. So thank you, Stephanie. We really appreciate it. Now it is my pleasure to transition over to talking a little bit more about our Action Network and the impact it's having on some of our members. So I am really happy and pleased to introduce Anna Corona Romero, who is a senior specialist for child and adolescent health systems building at the Association for Maternal and Child Health Programs. That's a mouthful, Anna. But thank you for being here, and thanks for everything you've been doing to help get this action network going. So I'm going to turn it over to you.
Thanks so much, Rachel, and I'm really delighted to be here to moderate this discussion, this mini discussion we're going to be having for the next few minutes. And I just wanted to share, for those of you who aren't familiar with AMCHIP, that we are a national level membership organization for state level governmental maternal and child health leaders. And today I'm delighted to be in conversation with Krista Lumpkins Howard and Michelle Simon. It's really nice to see you both. And I wanted to just pause and see if you wanted to say hello quickly and share which organizations you're representing today.
Sure. Hi, I'm Michelle Simon. I'm with the Institute for Natural Medicine, and we're a public-facing nonprofit that educates the public about whole person health strategies and options.
Hello, everyone. I'm Chris Lumpkins Howard from Birthing Beautiful Communities in Cleveland, Ohio. We are an organization of doulas supporting our clients up to a year, helping them to connect all the dots of life through their prenatal periods and postpartum and beyond.
All right, so why don't we jump in? I'll kick us off sharing a little bit about, I thought it would be interesting to share a little bit about what it is that I've learned from being a part of this network that I don't think I would have learned otherwise. And for me and the role that I play, which is really focused on guiding folks through systems initiatives, systems change, systems strengthening, I think what I've gotten from this network in particular is a much fuller picture of who really is involved in tackling hunger and pregnancy, and really just as importantly, not just the who, but also what they do in that space, and the value and the resources and the role that they play. To give you an idea of the folks that I've had the pleasure of connecting with and interacting with and getting to learn more about, there are folks who represent community-based organizations that are doing incredible work on the ground, like Krista's organization. I've connected with clinicians and researchers who are advancing the science, and I know, Michelle, you fall in that camp. I've gotten to connect with other public health leaders that represent local level government and local level initiatives, as well as state level, which is where I sit myself. You just heard from a policy expert. I've gotten to learn and hear from policy experts at both the federal and the state level, and again, the local level. So at all levels that we really need to be at in order to, again, tackle this complex issue that we're working on. I've been connecting with folks who support the workforce that has anything and everything to do with nutrition and making sure people have access to healthy foods and have what they need to be able to do that. I've been able to connect with funders, both private and public funders, and learn more about their initiatives and the role that they play in addressing this again, complex issue. And so the list goes on, but I won't take all of our time talking about that. But really, again, I just want to emphasize that for my role, it's been so helpful to get this broad level view of all the players in this effort to improve our systems for pregnant people. And not only just knowing about them, but having direct connections to people. It has influenced my work in so many ways. And just having that knowledge and being able to point the state governmental leaders that are doing everything they can in their settings to improve food access for maternal and child health populations to the resources, the expertise, the knowledge, and the help that others are eager to share in order to advance solutions. So um, that is really, I think, my biggest learning from this group is just having that high level view of all the folks. And I know that we all in the network have our own unique reasons on why we have joined the network or why joining the network matters. So Krista, I'll turn over to you to ask if you could tell other organizations or individuals why joining this network matters. What would you say?
I would say joining this network is so important because it's a movement. It's so cool just to be a part of a network that is not just addressing systems of inequality for food, but also housing, health, and access to care, and while building better relationships and stronger, equitable communities. So I think that makes more of an impact because we're stronger together than individually.
Yeah, that's absolutely true. And I think part of what's really exciting too about this group is the mission and the vision and just the shared direction and the understanding of what we're all moving towards together. And even within that, we have our different goals that we've all kind of come to consensus around. This is what we all want to work on. This is how we see ourselves moving that mission and vision together. So yeah, I really relate to what you shared, Krista. Thank you. And Michelle, I'm wondering if you could share with us and maybe round us out a little bit here by giving some more specific examples, maybe of how the network's resources, the connections, or the support have influenced a project or a decision in your work.
Yeah, for sure, for sure. I think the clarion call really for this action collaborative is the research. And I feel like that's one of the things I've learned so much about being in this network is the depth and the quality of the research underpinning developmental origins of chronic disease. It's just stunning to know how changing small things conceivably in pregnancy really can make this big difference in chronic disease. Like that is just a huge lever of change that we can all have a role in. Just knowing that, I think, has put a lot of things into place for my organization. So our nonprofit is the Institute for Natural Medicine, and we're really dedicated to educating the public and bringing whole person health mainstream. And that also means mainstreaming providers that are educated and trained really in diet and lifestyle and nutrition approaches, and those that focus on health promotion and disease prevention. We work with a lot of provider groups, so bringing this information to them has been very helpful. And our focus on educating the public has really been enhanced, I think, through this action collaborative. Like we've published articles, we've created content about it, we've created speaking opportunities with our residency consortium, and at Georgetown University's Masters in Integrative Health program for Dr. Kent Thornburg. And for the public, we now have a webinar actually on the power of nutrition for a healthy start. That's available for free to anyone at naturemed.org, which is our website. So bringing this message to the public directly through all of our channels has been strongly influenced by the information I've learned through this action collaborative. And I think it's an important strategy to continue to raise awareness and really bring the word not only to decision makers and policy makers, but also other organizations that have a kind of a horse in this race. I feel like this time is so interesting because there's so many opportunities for change to happen, but we're not really sure how that's going to shake out at the federal level. But one thing we really can do, and we are doing this action network, is to gather together this coalition of like-minded organizations and individuals to help really get a movement together. Because this is something that I think appeals to so many people. The importance of health and nutrition on late stage chronic disease is is fundamental really to our healthcare system and to the evolution of it. So we've always believed that a rising tide lifts all boats, and I feel like this action network is exactly that, the values that it represents for us.
Thank you so much, Michelle. And I also just want to build on what you said about all that we've learned about the research behind the importance of addressing nutrition in pregnancy, and how it's not obviously just for the benefit of the mother, but also for her children. And we've learned even potential grandchildren too. It just really goes 2 generations. And so I wanted to reiterate that that's been important for me to get behind the science and understand the science of that. And I know we all have our stories of the connections and the impact that working with each other has had on our different work and our projects and such. So I really, I appreciate you both having this conversation with me. I always like to brag on the network a little bit, and was happy for you both to join me. So with that, Rachel, I'll pass it over to you again.
Thank you, Anna and Michelle and Krista. Thank you so much for really your dedication to this work, and really appreciate your willingness to do anything to help make it succeed. I am now really pleased to hand the floor over to Natalie Haynes, who is the Executive Director of the Vitamix Foundation and has been instrumental in this work since the beginning, and are so happy to have her and the Vitamix Foundation team on this Action Network team. So Natalie, I'm going to hand it over to you.
Thank you, Rachel. It's an honor to be here, and it's a pleasure to be working with all of you. You're a great team, and you inspire me daily. As Rachel mentioned, I lead the Vitamix Foundation, and nutrition education for healthcare providers is a key priority for our organization. We learned through research that a family's trusted and primary resource for nutrition and healthcare information is their doctor. Ironically, most medical students receive fewer than 20 hours of nutrition education, and doctors in most residency and fellowship programs are not required to demonstrate any nutrition-specific competencies that would allow them to provide their patients with actionable advice about healthy eating. Additionally, it has been identified through our work with OHSU and the CDC Foundation that the lack of nutrition education and resources provided to all medical professionals is a barrier to implementing good nutrition in pregnancy and early childhood. Because of these factors, the Action Network formed the Nutrition and Pregnancy Provider Education Work Group. Next slide, please. The overall aim of this work group is to increase education of healthcare providers on the crucial importance of nutrition in pregnancy. Our initial priorities include identifying the work that each of the members are doing focused on nutrition in pregnancy, and next, identify actions and opportunities for partnering to increase provider education in nutrition in pregnancy. Next slide. So how do we define healthcare providers? They are providers who care for women of childbearing age and include medical providers, nutritionists, nurses, nurse midwives, doulas, community health workers, dentists, and pharmacists. Next slide. Current participation in the work group includes 25 members representing 13 national, state, and local organizations. And over the last year, we've heard presentations from different organizations to learn what they are doing related to maternal and child nutrition. And these include American College of Obstetricians and Gynecologists, the American College of Lifestyle Medicine, the Association of Public Health Nutritionists, the Gaples Institute, and most recently, Oregon Health and Sciences University Women's Health Center. Next, I'd like to share an example of the Vitamix Foundation's work in supporting provider nutrition education. In June of 2023, the Vitamix Foundation formalized a partnership with the Teaching Kitchen Collaborative and Dr. David Eisenberg to support a project focused on enhancing nutrition health education for medical students, practitioners, and allied health professionals. This was designed as a multi-phase project. The first phase of the project involved the creation and refinement of competencies for nutrition education of undergrad and graduate medical education using a modified Delphi survey method. A panel of 37 experts from across the U.S. participated, and after several survey rounds, the panel achieved consensus on 36 competencies for recommendation. This work was published in the JAMA Network Open in September 2024. Phase 2 of the project focused on developing a prototype repository of nutrition education resources. This project is still in development and not currently publicly available. Now that the project team has had the competencies identified and a prototype repository in development, the next logical step was the convening of key stakeholders. We also knew that it would be critical to have the backing of institutions that shape the curriculum and testing of physicians at this convening. So next slide, please. The project team successfully secured the support of two very important partners in advancing this initiative, the American Association of Medical Colleges and the National Board of Medical Examiners. As you may know, all accredited medical schools in the US and Canada are members of AAMC. And the National Board of Medical Examiners develops and manages all medical licensing exams. We also were greatly appreciated when AAMC agreed to host the convening in their headquarters in DC next April. The aim of the convening is to identify strategies to teach nutrition education and assess competencies. This will be a collaborative meeting with relevant stakeholders that includes educators, academic medicine leaders, and government officials. The call for speakers will open mid-September with a deadline of November 15th. We will plan to post the call on the Action Network's LinkedIn page. After the meeting is concluded, the best practices discussed will be summarized in the proceedings and published and disseminated broadly. So next slide. In the meantime, here are a few resources for your reading if you are interested in this subject. And this includes a summary paper from the Second Nutrition of Pregnancy Conference that was hosted in 2022 and the JAMA Network Open Competencies paper. Next slide. How to get involved. If you're interested in joining this work group, here's how. Join our monthly calls, share with us information on your organization's work, identify other organizations you think might be interested in joining the Action Network, and follow us on the Action Network's LinkedIn. Thank you so much for giving me the opportunity to share this with you. And I'd like to now introduce Karen Probert, Executive Director of the Association of State Public Health Nutritionists.
Super. Thank you, Natalie. And thank you to the others who've shared their stories and their successes and celebrations in being part of this group. So if we can move to the next slide, I have just a few minutes here to talk. I'll touch on some general information about the organization that I'm with, and then provide a couple of very specific examples of how we do our work and resources we provide. So I am, again, with the Association of State Public Health Nutritionists, and we are a nonprofit membership organization. Anybody who's interested in public health nutrition can be a member of ASPHN. And if we can go to the next slide. So we have just over 900 members, and we have anywhere from 3 to 20 members who join the organization each month. Well over half of our members work in state government agencies, whether it be a state Department of Health, Department of Aging, a Department of Education, and they run and administer the programs that Stephanie Hodges talked about that are in so much turmoil with all the federal funding changes. So there's a lot going on for members of our organization. But they do, again, most of our members work at the state level, who are responsible for policy setting within their state for the particular federally funded food and nutrition program that they work in. We also have members who work at the local level, faculty, and students in the organization. But it is important to note that almost half of our members have selected to join the Maternal and Child Health Nutrition Council. So it is an important population group for the work of our members. And if we can go to the next slide, please. ASPHN has been around for a long time, and we can go to the next slide. The organization's focus is on leadership development. Because our members work in so many federally funded food and nutrition programs, they typically have an organization that provides technical assistance and guidance on the program that they work in. So they come to ASPHN to focus more on those cross-cutting skills in leadership development. And we can go to the next slide. One of our big areas of focus is providing resources and projects that help our members do their job better. Next slide. So I just want to hit on 3 that are particularly relevant to this provider nutrition, to this provider work group. One of our programs that just ended last week after 5 years is called the Children's Healthy Weight State Capacity Building Program. This program focused on the state Title V Maternal and Child Health Block Grant Program in 3 states, and helped. And one of their strategies was actually on provider education, building the nutrition competency of the Title V workforce in those 3 states. One provider group that it wasn't mentioned in the previous list, but I think is relevant to this work group is those providers who are in early care and education. So those professionals that are providing childcare, daycare, preschool, that's an important group that we work with, and we have several programs and services that focus on helping our members do farm to early care and education. Many of you may have heard of farm to school. Well, this is a focus on that younger age group. And then we also have a program that is includes about 24 to 26 state WIC programs that are focused on or incorporating developmental monitoring statewide in WIC clinics. So we can go to the next slide. So nutrition security, hunger prevention, food and nutrition insecurity. Moving to the next slide, please. Whatever term you use, I want to mention a couple of resources that we have in this area. But I thought, since we're talking about connections, and I wanted to provide this very specific example. So the work group met last week, the provider work group, and there was a presentation by a program that was trying to identify how to help clinic staff address food and nutrition security with the patients at that clinic. So following that presentation, I was able to connect the state Title V maternal and child health nutritionist with the person who was doing that presentation, and they're now going to do some follow-up collaboration and work together on how to focus on food and nutrition insecurity, or insufficiency is the term of choice for the state of Oregon. So that's an example of sort of how our members can connect with work that you might be interested in. We'll go to the next couple of slides that cover a resource that we released about 3 years ago. We call it the Food and Nutrition Security Primer. And the focus of this is a table, which if you flip to the next slide, is I've just captured a couple of terms in the table. So we have over 70 terms that are used to describe food and nutrition security. And these are all terms that are just used by federal agencies and some of the more common terms used by national non-governmental organizations that describe inadequate access to healthy foods in a community. And so this table lists all those terms. It identifies key words to show the user where that term might have overlap for a term they might be familiar with. And then we include the actual definition of that term with links on where to find that resource. So that might be something that folks are interested in, because the terms used by us all in this area can vary, but usually we all have a common goal. So that was our intent of providing this resource. And that's really all I wanted to cover, was a few general points about our organization, but also a couple of specific things we can do that we do within the organization. Happy to take questions at the end. Thank you.
Thanks, Karen. It's so nice to have your involvement in our work group. We're really thrilled to have you, and we hope we're going to get a few more as a result of today's session. No questions in the chat yet, but please feel free to add them. Natalie and Karen, question I have is, what are some of the biggest barriers to providers educating patients on nutrition, especially during pregnancy?
Natalie, do you want to go first, or you think?
I was going to let you, since you're more in the thick of things with patients than I am.
So I'm going to answer that question more from a policy perspective, because our members are working more at like state policy level. And while they're also working in programs that focus, that help providers teach nutrition to patients. So I think some of the biggest barriers are going to include programs that have already been talked about here that are trying to address those gaps, which is providers not having enough information or confidence in what to talk about with their patients, but also just available time. Also, I think we tend to get in our own lane on our program or our strategy or our topic of interest and focus. And so one of the great things about what this group and this network, this action network is doing is helping us learn about other programs and services so we can break our own barriers and be able to either cross-refer or just keep in mind some of the other pieces of information that in this case, pregnant women are wanting to know about. So.
And I would just add that from what I've heard, and it's not from direct experience, but more that there's also in practice, there's a lack of time and the ability to do that. Then just also not having the knowledge and the tools and resources. So how do we move this forward? Is it maybe develop some quick resources and help our providers with that, and then work through this whole nutrition education program that one of the projects like we're working on. It looks like we have a hand up here. Someone raised their hand. Marie France.
Yeah, thank you for presenting all that. I'm Marie-France Hiver. I am an endocrinologist by training, and I do treat pregnant people who have diabetes. And I also am the director of a course at Harvard Medical School to teach future doctors about nutrition. So I'm wearing two hats here. And I want to say from the students in training, what they're really seeking is practical knowledge, not like like nutritional deficiency or pathophysiology of how certain nutrients work or are lacking in our disease system, but really about addressing questions from our patients. And from the patient perspective, what they want is have a provider that opens up the discussion and is not afraid of having or entering the space of nutrition. Of course, we're not aiming to have doctors who have all of the knowledge of registered dietitian. We want to have MDs who have enough enough knowledge to be comfortable to open a discussion and refer to our specialists who are trained to talk about all of the details with our patients.
Thank you for that really practical advice. I also see that Diane Stadler has offered some other information in the chat as well that I feel like supports that. So thank you for that comment. And then we have time for one more question, I believe, and that is really for our group here, as well as anybody in the audience, if you want to add in the chat. Are there other types of healthcare providers that we should be reaching out to that we maybe haven't so far? Well, you don't know everyone that we haven't, but Natalie did put a list of the different types of providers that we are reaching out to. Are there any that you didn't see there that you'd like to encourage us to reach out to? Well, feel free to add it to the chat. Even we have a few more minutes with you, or we're going to be sending a survey after today's meeting. Especially, we want to know if you want to get involved with any of our work, and that would also be an opportunity to let us know any other providers. Karen, Natalie, thank you so much for being here today, sharing your time and wisdom, and of course, for your leadership and involvement in our work group. So thank you so much. With that, I am going to turn this over to Liana Haywood, who is with the Moore Institute at Oregon Health and Science University, who is going to round us out today. Liana, it's all yours.
Hi, I'm super excited to be the one to get to help tie together all the threads that we've heard about today, and reiterate sort of why we're here, where we want to go, and talk to you about how you can join us and be part of this movement. So the first thing that I would love if you just could, in the chat while I'm talking, type in one new thing you learned today, one new piece of information or something that you're going to take away, and one thing that you or your organization would be willing to commit to before the December 3rd meeting. And that could be something as small as like, I'm going to go read an article more about the science and see what else I can learn. I'm going to start a conversation at work about this network and what they're doing, or you're going to join the LinkedIn group, or you're going to want to go further and really be an active member of this group and want to put on the survey that you'd like to have a call with one of us to kind of see where you could fit in. So it doesn't have to be a great big commitment. If you just go ahead and like put those in the chat, and then I will talk about a few other things while you're doing that. So I just wanted to reiterate that, the work that we're doing is grounded in this field of science called Developmental Origins of Health and Disease, or DOHAD. And we know that if we can work together to improve nutrition during this time period, we can have major implications on the health of society through decreased chronic disease rates, not just in this generation, but in future generations as well. And we know that this issue is way too broad for any one group to tackle alone, right? It needs a concentrated effort from a variety of groups, which is why we're all excited to partner, to work together, to find ways we can collaborate, just to really, as we heard a little bit today, get to know each other better. So when that question does come up, you have the phone, the email for the person who works in that area and can reach out. Or when you see that grant opportunity, or when you have a question about how does WIC work, how does SNAP, like whatever, that you have the resources, the people, the connections available to you to find the answers and that you need. So I also want to talk about a couple of things that we heard today. You heard from Diane, sort of the groundwork that we have put down over the past year to really get this group on a good foundation to build from. We're at a point now where we're ready to grow and expand and find other people who are working in these areas to really be a part of this discussion, because we know that there is a lot more work that's being done that we aren't aware of. We know that there are other ideas and conversations out there that we want to be a part of. We heard from Stephanie on all kinds of updates to federal implications with SNAP impacts. We've heard about the relationships that have been built so far through this network. And I really want to emphasize that's a key piece that we want to do, that we think that if we know each other, right, we have those relationships that helps move the work along further and faster. So one of the things that we have done is try to identify, are there conferences maybe that several members would be going to? Like last year, it was the AMCHIP conference that we planned a little meet and greet reception, just so we can have those opportunities. Maybe it's just meeting up for coffee or lunch at a conference where several of us may already be there, just to be able to get those personal relationships really going. And then we've also heard a lot about how how to increase and improve nutrition education for healthcare providers, and really the importance of getting that, because we know that that's one of the many, many steps that will be included and necessary in order to improve nutrition before, during pregnancy, and in the first years of life. So now I just want to talk to you a little bit how you can join us. What can you do? I know not everybody has, I know no one has unlimited time, right? If you do, then I would love to know how that happened. But there are several ways that you can kind of go along with what we're doing. It can be as simple as joining our LinkedIn group and kind of seeing what people are posting. It can be just attending these quarterly meetings when you have time. If you would like to go a little bit deeper, we have a Google group email list that you can sign up for, where you will be getting more regular updates. We'll be doing occasional sort of digests of updates. And it's also a place where you can reach out and ask questions for those connections that you've made. I talked a little bit about the meet and greets. We would like to plan some more of those in the coming year. If that's something that you would be interested in trying to plan, put together, host, we would love to hear more about that. And if you want to go even deeper, we know that there are areas that could use another working group. We have the one working group working on provider education. There absolutely are opportunities. Maybe somebody has something that they feel really passionate about that aligns with the work and the people we're seeing here, and you want to step up and say, like, let's find others who are working in this area and start a working group and explore this issue a little bit more. We have opportunities to join the steering committee. We have a great group of people. We've been working together for over a year now in these monthly meetings. And then we have a smaller like core team that meets on Mondays that we have called ourselves like the Women Who Get Stuff Done group, because it's just been really great of like, let's just like go, get people excited and get this work done. So as you've heard from several people in the meeting today, we are going to send out follow-up information. There will be all sorts of links to the things that you've heard about today, but there will also be this opportunity to say, like, you know, I want to learn more. And we will connect you with a member of our steering committee. We're going to split up who is talking to which groups, because again, we are really focused on trying to develop those personal relationships. So it's not going to just be one person. And this doesn't need to be like, hey, I have an idea for starting a working group. Sign me up. I'll have this conversation. It could just be like, you know what? I was really interested in what you had to say. And I just want to tell you who I am and what my group does. Just sharing a little bit about who you are, as well as us getting to know, or you getting to ask us any questions about what's going on. So it really, you know, we would just like to meet more of the people who are in this room. And then what is the last thing I'm going to say? Oh, the quarterly meetings that we're hosting. The next one will be Wednesday, December 3rd, as you saw, same time period, about the same length. And we are going to try to dive a little bit more into the science that we talked about today of developmental origins of health and disease. We heard several people talk about how the research has really helped inform the work that they're doing. And we know for a lot of people that this is fairly new kind of area of research. And so we're going to have several people be able to dive into that a little bit deeper, talk to you about what it means, what the research is, and what's on the horizon. And the idea is that these meetings quarterly won't always be the same. We want to engage more people. We want you to hear from lots of different voices. We don't want you to see the same faces here all the time. So if there's an idea or something that you have that could be a part of one of these meetings, we would love to hear that from you as well. So when you get the information tomorrow, you can check that, like, let's have a talk and I'll tell you about X, Y, or Z issue person who should be part of this organization or a future meeting. So with that, I think that's, do I have one more slide or is that it? I should probably know. Oh, yes, the upcoming meetings. So you can mark your calendars for December 3rd, March 4, and June 3. And as mentioned, we will send you a link so that you can hold the date for those as well in the follow-up information that we sent. But I will pass it back to Rachel, but I want to thank everybody who came today. Super exciting for us to see how many people really saw an interest in talking with us today. And we hope to see you again, hear from you again. And we are here for any questions that you may have. Back to you, Rachel.
Thanks, Liana, and thanks to everyone who participated today, our presenters, our panelists, and every one of our guests. So I've been keeping one eye on the chat, and it's really nice to see what folks are going to do as a result of being here, what you learned, and we really hope we're going to see you every quarter, if not more often. So stay tuned for a survey that's going to follow this probably tomorrow or the next day, so that you'll have the slides and the recording, as well as a survey that'll just ask how you thought this meeting went and if you want to get involved in other ways. We just want to make sure that you have an on-ramp for doing that. So onward, we will continue this great work, and we look forward to connecting with all of you in different ways. And my lights just turned off, so I guess it's time to go. Thanks, everyone. Have a great day. See you
Thanks,
soon.
everybody. Bye.
Bye.